Today we are going to continue with our study in pharmacology, and we'll be looking at the pharmacology of the antibiotic called aminoglycoside. Now for aminoglycoside, we'll be using the outline, we'll talk about the basic structure, the mechanism of action, the resistance, classification based on origin, classification based on site, adverse effect, therapeutic uses, and then its spectrum. Alright, now for the structure of aminoglycoside, I think I'll show you some circles like this. So we have some circles like this, which I will call the aminocyclical ring. This is the aminocyclical ring. Now, this aminocyclical ring is attached to an amino sugar. It's attached to an amino sugar using a particular bond called the glycosidic bond. So this is a very basic structure you should have in mind, especially as one who is not doing specialty in pharmacology. So this should just be in your mind. Now, what the important chemistry about it is that this particular structure is a basic compound. It's basic. It is water soluble. It is water soluble, and then it has poles. That means it has a different electrodes. So we call it a polycation. Okay. Yes, or to say polarity. It has polarity. I think that's the right word to use. Polarity. Okay, so these are basic introduction here for the structure. Now, what then is the mechanism of action for aminoglycoside? Now, for the mechanism of action for aminoglycoside, we're going to note that aminoglycosides, they are going to be active. Now, there's this mnemonic I want you to remember. They are protein synthesis. What are all the protein synthesis inhibitors? Drugs that inhibit protein synthesis in bacteria, protein synthesis inhibitor. Now, we remember it with 30S, that is at 30, and then cell 50. Cell 50S. That means drug A and T. What does A stands for? Aminoglycoside. Aminoglycoside. What does T stands for? Tetracycline. Now, aminoglycoside and tetracycline will inhibit protein synthesis by binding to 30S ribosomal units. Alright? Then cell 50. C here stands for chloramphenicol. Chloramphenicol. Okay? The E here stands for erythromycin. Erythromycin. So some people call it macrolide, same drug class. Alright? The first L here tells you about lincamycin. Then the other L, linezolid. Now, for all of these, we inhibit protein synthesis by binding to 50S ribosomal unit. Now, if you are asked in the exam that what is the mechanism of action for aminoglycoside, I think someone who has gotten to this point would say it inhibits protein synthesis of bacteria by inhibiting the 30S ribosomal unit. But you now will know better. Let me show you what to note. These are some things you have to add. Let me show you the bacteria. This is how the bacteria looks like. And then we have our nucleus in the bacteria. In the nucleus of the bacterium, we have the mRNA strand. Let's say we want to synthesize it here. And then we have our 50S, and then our 50S, and then 30S ribosomal unit, something like this. Now, aside binding to 30S ribosomal unit, what does this mean to stop? What does this mean in the bacteria? So this is the bacteria, and then this is the what? The nucleus. All right, now let's begin. Number one, we are going to have, let me use a triangular fashion to illustrate this. And we said aminoglycosides, they inhibit 30S ribosomal subunits. Now, what do they do? Number one is that they inhibit initiation. They inhibit initiation. Now, I'm going to dedicate a separate video in the biochemistry of nucleic acid and nucleotide just specifically for protein synthesis, otherwise called translation. So number one thing that aminoglycosides do by binding to 30S ribosomal unit is that they will inhibit initiation. Initiation never occurs. They are also going to cause misreading of the mRNA strand. Okay? So for now, I want you to trust me, okay? But it's very important that you know these other signs. But I will really explain it in another video to really explain to you what protein synthesis occurs and how this means to aminoglycoside. So aminoglycoside inhibits initiation, cause a misreading of mRNA strand. It is going to also terminate translation or will terminate protein synthesis. Now, what should the result of all of this be? The result will likely be that there is going to be the incorporation of, we're going to incorporate folding amino acid, and folding amino acids will lead to abnormal proteins. Okay, so abnormal proteins will eventually be formed. So one person that already knows this mnemonic knows that what's the action of aminoglycoside inhibiting 30S ribosomal unit. But you now know something better, that not just inhibiting 30S ribosomal unit for full marks in long answer questions, is that it inhibits initiation, number one, causes a misreading of mRNA strand, causes the termination of protein synthesis, or termination of translation, and also eventually leads to the incorporation of a faulty amino acid that leads to abnormal proteins. Okay, so that's the very important information about the mechanism of action. Now let's go a little further. For the resistance, before I talk about resistance, let me say something. Let me draw this diagram I did here, even more than that, so you can see. Now, watch this. Watch this. This is a large diagram now. This is a large diagram of our bacteria. Now, these bacteria here, so I'm going to call it bacteria. Okay? Now, we have our nucleus. Our nucleus. Now, in this nucleus, what do we see here again? We see that there is the mRNA strand, and we have our, which S again? 50S ribosomal unit, and what? 30S ribosomal unit. That's the first thing. Now, what's the next thing I want us to appreciate? Number one, this drug, aminoglycosides, will need to enter. They need to enter and then find their way to bind to 30S. If you remember what we said before. Now, but what happens? Something quite very, very interesting happens. Now, is that I want to, before I talk about resistance, I want to tell you some things that can reduce, what are things that can reduce the entry of aminoglycosides to their sites? This is very important for MCQ. Number one, when there is a fall in pH, or simply put, acidity. This is very important for MCQ questions. Now, what do I mean? Remember that aminoglycosides themselves are basic or alkali structures. So a fall in pH also is going to reduce the amount of them that enters. Okay, so that's what I'm trying to talk about. Number two, in hyperosmolality. Number three, in anaerobic conditions. In anaerobic conditions, okay? Or even when there is a presence of divalent cations. So divalent cations, like the lines of magnesium 2 plus, okay, calcium 2 plus, etc. Now let me talk about the resistance number one. What are resistance? When we say a person has resistance to any drug, we simply mean that that drug has no effect on bacteria, or bacteria have been able to find ways to evade their destruction by that drug. So how has this bacteria been able to evade the ways in which this drug would have acted on it? Number one, if you give someone aminoglycoside, there are some kind of enzymes here that are on the membrane. These enzymes on the membrane, we call them the inactivating enzymes. So inactivating enzymes, what do? Inactivating enzymes, they either adenylate, they either acetylate, or they either phosphorylate on the cell membrane. So what happens is that anytime aminoglycoside goes there, it can either be acetylated, adenylated, or phosphorylated, and its action becomes futile. So that's number one mechanism. So number one mechanism for resistance is adenylation, acetylation, or phosphorylation of these drugs on the cell membrane, making them inactive. Now, number two can either be inefficient transport mechanism. The inefficient transport mechanism, I mean that there are less channels. That means there is a fall in influx channels, or there is an increase in efflux channel. So efflux channel have increased. So an increase in efflux. So please remember these two. So when we talk about that, there is inefficient transport mechanism. Either the amount that enters into this bacteria has drastically reduced, or even if they entered inside, we pump them out, increase in efflux. So that's the second mechanism. So this is number one, mechanism of resistance. This is number two, mechanism of resistance. Now, number three mechanism of resistance is that these 30S ribosomal units, there could be some mutations around the positions where these aminoglycosides will bind. So we say number three, mutations that causes a fall in affinity to the ribosomal proteins. Good. So when there's mutation that causes a fall in the amount of aminoglycosides that eventually reach their site of action, that is something to really consider. All right, so that has been for resistance. Resistance, there are three resistance. Number one, inactivating enzymes that either acetylate, adenylate, or phosphorylate. Number two, we said inefficient transport mechanism. Either we increase the efflux or we decrease the influx. And then number three, we have said mutations that will cause a fall to affinity to ribosomal proteins. Okay. Now let me leave all of this. Now the next thing I want to say is the classification of aminoglycosides. Now some people have classified aminoglycosides based on origin. Well, some people have classified aminoglycosides based on origin. Now based on origin, we can classify aminoglycosides based on origin. We have the semi-synthetic, and then number two, we have the natural semi-synthetic, and we have the natural. Now, what do we have here in the semi-synthetic and natural? Now, for the natural, we have the streptomycin. Streptomycin, it was gotten from Streptomyces griseus. We have the likes of Sisomycin, or even gentamicin, that have been linked to be discovered from Actinomyces micromonospora. All right. So that's it for natural. Therefore, semi-synthetic, we have the likes of amikacin. Amikacin was derived from kanamycin. We have the like of netilmycin that was derived from sisomycin. So the list goes on and on. But these are natural ones that were gotten from bacteria. These ones are the ones that were produced from already made ones. So this is a classification based on origin. Now, classification based on the site of action, we have just two based on site. We have number one here, those that act systemically, we call them systemic aminoglycoside. And then number two, those that act at the topical or on the skin, we call them topical. Now, what are the systemic again? Systemic, see, we have thromycin. I think you remember it with tiny scale. So A here, amikacin, okay, and here, netilmycin. Tilmycin, G here gentamicin, S here streptomycin, K here kanamycin. But for topical, we have just NP, that is neomycin and pyrrolomycin. All right, so that is that for classification based on origin, classification based on the site. Okay, now for the next one here, that is going to be for adverse effects. What are the adverse effects for the aminoglycoside? The adverse effects, we have basically number one. Now, how we used to remember it? We remember it with a mean guy. A mean guy. Just like if you pronounce aminoglycoside, a mean guy. So when someone is mean, that gives me a deadly blow to my ears. Okay? He gives a deadly blow to the ears. He gives a deadly blow to the kidneys. Okay? He leaves this person paralyzed. All right? And also, he has actions to the people's children. That is teratogenic. So you can remember it this way, that aminoglycoside is a mean guy that gives a deadly blow to the ears, gives a deadly blow to the kidneys, leaves the person paralyzed, and also has effects on people's children. So let me take it number one. For the ear, I call that ototoxicity. Ototoxicity. Ototoxicity, since it's cranial nerve 8, that is the ear, I'll divide it into two because it's vestibulocochlear nerve. Those that are going to be for the vestibular parts and those that are going to be for the auditory parts. For the auditory, I remember using KAM, that is kanamycin, amikacin, and metilmycin. Okay, then for vestibular here, we have the likes of streptomycin and gentamicin. Streptomycin and gentamicin. All right. Now, number two, based on this, dangerous to the ears. How about to the kidneys? That is nephro what? Toxicity. Nephrotoxicity. Now, for nephrotoxicity, what is the least nephrotoxic? That one is streptomycin. Streptomycin is the least toxic. But which one is the most toxic? Neomycin. Neomycin. Alright? So that's dangerous, so you must monitor levels. How about leaving people paralyzed? We call that neuromuscular blockade. Neuromuscular blockade. So you can tell that it's going to worsen in people that already have myasthenia gravis. So for neuromuscular blockade, we have this mnemonic like NKAGT. This is in decreasing potency. In decreasing what? Potency. So in decreasing potency, for neuromuscular blockade, what happens is that neomycin is stronger than kanamycin and will even cause more havoc than amikacin, that will cause more havoc than gentamicin, that will cause more havoc than tobramycin. Then there are others, like the likes of other conditions, like we say teratogenic for the children, so should not be given to the mothers during pregnancy, and also hypersensitivity reaction. Hypersensitivity reaction. So hypersensitivity reactions. All right. Now let's continue. So we have talked about adverse effects. How about therapeutic uses? For therapeutic uses, I'll be listing as many as we can think of, but there are so many. We have the likes of meningitis. We have tularemia. There's sepsis. We have the respiratory tract infection, urinary tract infection. We have the likes of cystic fibrosis, and what have you. The list is so much there. So the uses have been useful. Then what about spectrum? It is broad spectrum anyway. It is broad spectrum, but more effective against gram negative. More effective against gram negative. All right, so with this, we have talked about aminoglycosides at a glance. These are rapid revisions for you. So if you really wish to learn more of this, please like, subscribe, and share this video so that it gets to reach lots of students, and then YouTube also have to recommend this to others who might find it helpful, and you also get to see our videos as we get to upload them. Okay, now also comment what stood out for you in this topic, and also if you have questions, also put them down there in the comment section. I'll be willing to respond to them. Do have a nice time. Thank you. Bye.